Hello, today I am presenting what diagnostic factors affect type 2 diabetes in females. A little bit about me. I am majoring in economics and will be graduating in May 2023. I was born in China and will be continuing my studies at the Australian National University for a master's degree. An introduction to this research. Type 2 diabetes is a condition in which the body's mechanism for regulating sugar and using it as fuel is impaired. Due to women's own physiological characteristics, they must go through special physiological stages such as pregnancy, lactation, and menopause in their lifetime, which makes female patients have some special symptoms different from male patients. Type 2 diabetes diagnosis entails a high clinical and public health burden because of the difficulties in managing the condition and the dangers of acute and long-term consequences. Our purpose for this paper aims to predict what diagnostic factors have significant impact on the probability of having type 2 diabetes among female patients. This paper will examine likely determinants of different variables on the outcome of diabetes in women through linear probability model and the logic model. A little review of the literature. Children, adolescents, and younger adults are increasingly being diagnosed with type 2 diabetes, mellitus, and prediabetes. Rising adult and adolescent rates of overweight and obesity are linked to the global type 2 diabetes epidemic, according to Chen 2012. Before and after accounting for the variations of BMI, the risk of diabetes is considerably greater among Asians, Hispanics, and Blacks than among Caucasians. For Asians, weight gain is particularly harmful, according to Shai 2006. With women being more than 1.5 times greater risk than men, obesity is by far the strongest modifiable risk factor for type 2 diabetes, and this was 3 times higher in women, according to Sobers-Granum 2015. Overall, this suggests greater risk of diabetes, greater prevalence of diabetes, and potentially poor diabetes control in women compared to men. So we have 2 models here, which is set to investigate the impact of different factors on the probability of getting type 2 diabetes in females. The first model is the linear probability model, LPM, which is specified right here. And the second model used in this report is the logic model, which is also specified down right here. For this first model, the table of definition of variables and their expected sign, the dependent variable is the outcome of a female's diabetes test in the census, which means that it is a binary response variable. If outcome is equal to 1, it means the female patient has type 2 diabetes, otherwise it is equal to 0, which means the female patient do not have type 2 diabetes. There are 9 explanatory variables included in the regression model. This includes number of pregnancies, glucose level in blood, blood pressure, thickness of the skin, insulin level in blood, body mass index, diabetes pedigree function, a person's agreed age, and the square of age. For this table, it summarizes the variables used in this report. Outcome is a binary variable taking 0 for a patient without diabetes and 1 for a patient suffering from diabetes. The mean of outcome shows that approximately 35% of the subjects in the sample has a positive outcome in the diabetic test. It is also noteworthy that the average body mass index reaches 32, which is considerably higher than the upper bound of normal weight, about 25, referred to American Cancer Society. This table displays the correlations between the regressors. It is used to detect potential problem of multicollinearity in the dependent variables, which cause the coefficients to be biased and inconsistent. The following figures demonstrate the scatter plots between the outcome of diabetes and PDF as well as BMI. As outcome is a binary variable, example, it takes only 2 values. The scatter plots show that there are 2 straight lines at the level of y equals 0 and y equals 1. When variables increase, there are more y's equal to 1. Based on the LPM, the most significant regressor on the outcome of diabetes diabetes is DPF. It shows that 1% increase in pedigree will lead to an increase in the likelihood of having diabetes by 13.79%. BMI, age, and glucose level are significant and positive factors that influence the diabetic outcome. In addition, the skin thickness and insulin level in blood are statistically insignificant at 5% level. Based on the output in this slide, glucose is significantly and positively related to the outcome of diabetes. It is consistent with our expectation that higher blood sugar level is a direct and strong indicator for diabetes. However, the marginal impact of glucose is not high, such that an increase in 1 unit of glucose is 0.72% more likely to lead to diabetes. Body mass index is also highly significant on diabetes, with 1 unit increase in BMI leading to an increase in probability of having diabetes by 1.64%. In conclusion, this paper reports the diagnostic factors that have significant impact on the outcome of type 2 diabetes for females. Glucose is significantly and positively related to the outcome of diabetes. Body mass index is also highly significant on diabetes, with 1 unit increase in BMI lead to an increase in probability of having diabetes by 1.64%. The most dominant impact on diabetes stems from genetic factor, and on the other hand, the thickness of skin, number of pregnancies a woman had, and an insulin level have surprisingly small effect on the chance of getting diagnosed with diabetes. Our recommendation based on research is that it encourages the local government to take actions to deal with the prevalence of diabetes in female patients. Patients are advised to take more exercise to shed weight, and by controlling their BMI, these female patients will have lower probability of having diabetes. But there are limitations. These models are subject to omitted variable bias and measurement error, which can lead to biased estimates. The sample size is relatively small in terms of diabetic population, and only female patients who suffer from obesity are sampled. Further research should focus on a larger sample. And here are my references. Thank you so much for your time.